Okay, for the last chart, we have the force field analysis, and the force field analysis is used to look at the driving and restraining forces of the root problem. It allows for brainstorming of all the possible forces that work for and against a solution. It also allows for an honest reflection of the underlying roots of that problem. So in the force field analysis for this case study, the driving and restraining forces were looked at and compared to one another. There were four main driving forces that were identified, for which were the patient's diagnosis, the nurse's assessment, the initial interventions done for the patient, and the nurse's notification to the provider after the patient significantly declined. All four of these driving forces would act to secure change in the system, so that patient care could increase and patient deterioration could be better identified. The patient would need to be properly diagnosed, and the nurse needs to provide an accurate assessment so that proper treatment can be administered. The initial interventions would need to be done in a way that would benefit the patient and the provider should be notified of any decline in health status. Okay, so for the restraining forces that were identified, that the nurse attributed the patient's condition to anxiety. There was a delay in the recognition of vital signs. The vital signs were not properly checked to see a decline, and there was a failure to inform the physician of the decline in status until it was too late. All of these forces restrained proper care and would increase the patient's likelihood of decline. The restraining forces would put a strain on patient care and prevent the success of the plan that has been implemented.